We've reached an agreement. There shall be no halting of services at the private sector.
A sigh of relief not only for hospitals across the country, but also for millions of Kenyans enrolled to the National Health Insurance Fund and who seek services in private hospitals.
The private sector is a strong and weighted champion with us, with the public facilities, and service provision is actually on par 50 to 50% between the public and private sector.
The contracts between NHIF and all service providers will be signed after the 30th of March or 31st of March, because the 31st March has 31 days. And for implementation, we will start the new contracts with the new benefits on the 1st of July.
In the March objected contract, NHIF had sought to reduce the amount payable by the fund for patients seeking critical care such as dialysis and all surgical procedures. This, according to health professionals, would place a huge financial burden on the health facilities.
We would like to urge the Ministry of Health and NHIF to consider expanding the kidney transplant package, so that most of the patients who are on dialysis can be able to transit to transplant. And we all know that a transplant is cheaper to maintain, it will cost less than dialysis, and it also accords a patient a better quality of life.
A section of health workers, however, lash at the government for making minimal investments in the healthcare sector while demanding quality, affordable services.
If the government is running the UHC only with the contributions that the public are doing to in NHIF, then I believe we will not be able to have a sustainable service provision as expected. You have an NHIF card, you need to get the services, but in many instances there are no doctors. In other instances there are no laboratory services. In other times there are no drugs. So it's entirely you have to go to the private sector to get the services. For the UHC to work, there's need to have more funds in the public sector, and there's more funds in healthcare in general.
The new contract, set to be implemented in July of this year, is expected to bring with it a tremendously affordable and top quality health system. But as for now, it remains a wait-and-see situation. Ben Kerera, K24, Nairobi.